Larynx. The first thing that we have to discuss the cartilages of the larynx. This is the thyroid cartilage. Each thyroid cartilage has a lamina, thyroid lamina. And this is another thyroid lamina. And both meet together in the middle line, forming a projection, what's called the Adam's apple. Projecting from the lamina, this is a process upwards. It's called superior corneo or superior horn. And another one which descends downwards is the inferior horn or the inferior cornea, which articulate with the cricoid cartilage, forming the cricothyroid joint. On the lateral side of each lamina, there is an oblique line. And this oblique line has its importance for muscle attachment. This is the oblique line. The thyroid lamina, they united anteriorly, but posteriorly, there is a gap between the two lamina. It looks like an open book. This is the thyroid cartilage. Below it, this is the cricoid cartilage. The cricoid cartilage lies at the level of cervical 6. This is the vertebral level. It has a lamina posteriorly. This is the lamina. And it has a ring anteriorly, which this is opened, an arch, and there is an opening here. It looks like the ring. It has an anterior arch and posterior lamina. It articulates with the inferior horn of the thyroid cartilage. At the upper border of the lamina, there are two cartilages, pyramidal in shape. This is the arytenoid cartilage, which has an apex here, and it has a lateral border, and it has an anterior border. Anterior border, and this is the lateral border, and this is the base of it. It articulates with the upper border of the cricoid lamina. One right and one left. From the anterior surface, in the middle line exactly, at the site of union of both lamina, arises a leaflet-like cartilage. And this is called the epiglottis. It looks like leaflet. It's made of elastic, elastic cartilage, so that it cannot be ossified in the future. There is a membrane. This is the hyoid bone. This is the body of the hyoid bone. This is the lesser horn, and this is the greater horn of the hyoid bone. And there is a membrane between the upper border of the thyroid lamina and the hyoid bone. It's called a thyrohyoid membrane. From here and from the other side. Thyrohyoid membrane. If we look to another specimen, this is also the skeleton of the larynx. This is thyroid cartilage, and this is the hyoid bone, and this is the thyrohyoid membrane between the upper border of the thyroid cartilage and the hyoid bone. And the cricoid cartilage is covered by this muscle. Is covered by this muscle. If we look from inside, I'll find this is the cricoid cartilage. And there is a membrane comes from the cricoid cartilage, reach the thyroid cartilage. This is called the cricothyroid membrane. The upper border of this membrane represents the true vocal cord, which is attached to the anterior process of the arytenoid cartilage and to the thyroid cartilage. This is the true vocal cord. And this is the epiglottis, and this is the arytenoid cartilage. Between the arytenoid cartilage and the lower part of the epiglottis, this is the quadrate membrane. The quadrate membrane. The upper border of this quadrate membrane is called aryepiglottic fold. And there is a muscle, aryepiglottic muscle, covered by the mucous membrane. With the other aryepiglottic fold from the other side, this represents the inlet of the larynx. Usually the inlet of the larynx vertical like that, and it is bounded anteriorly by the epiglottis, on both sides by the aryepiglottic fold, posteriorly by the arytenoid, and this is the inlet of the larynx. The lower border of this quadrate membrane represents a fold, which is called the false vocal cord or the vestibular fold. Usually in the living tissue, the vestibular fold or the false vocal cord looks pink in color, while the true vocal cord appears white pearl in color. Between the true vocal cord and the false vocal cord, there's here a depression here inward. This is called the sinus of the larynx. The sinus of the larynx. If we look to the soft tissue, stop.